Can you move your bag from in front of that,
What do you need?
that red bag so I could see the...
Oh, yeah.
Okay. Thank you.
Okay. All right, I'm going to count you in 5, 4, 3, 2.
Welcome to Aaron and Aaron Legal Education, also known as Ulrich Nash and Gump. We're located at clelaw.com. You can also reach us at 916-652-3000. It's January 8th, 2021, and we're recording live from Colfax, California. Welcome. My name is Dr. Gloria Freeman. I'm here today talking to you about COVID-19 and vaccines. And we can also talk about whether you're going to get a vaccine. We're going to talk about the public health emergencies related to COVID, and we're also going to talk about the regional stay-at-home orders and those orders as well. We'd like to say hello to all of our attorneys out there, and this will be for 1 hour of MCLE credit. The United States Public Health Department, on January 4th, Alex M. Azar, he renewed that a public health emergency exists. As a result of the continued consequences of the coronavirus 2019 COVID-19 pandemic on this date and after, consultation with public health officials as necessary, I, Alex M. Azar II, Secretary of Health and Human Services, pursuant to the authority vested in me under Section 319 of the Public Health Service Act, do hereby renew, effective January 21st, 2021, my January 31st, 2020 determination that I previously renewed on April 21st, October 23rd, my January 31st, 2020 determination that I previously renewed on April 21st, July 23rd, and October 2nd, that a public health emergency exists and has existed since January 27th, 2020 nationwide. That's the federal law. Now we move on to the state of California. They also issued a stay-at-home order, the public health officer, on January 5th, 2021. This is an order of the state public health officer. Hospital surge has an amendment. California is experiencing an unprecedented and exponential surge in COVID-19 cases, and staffing and other resources are becoming strained. COVID-19 hospitalizations have increased 7-fold over the last 2 months, while COVID-19 intensive care unit hospitalizations have increased by over 6-fold over the last 2 months. And large proportions of California hospitals have reached significant strain on their ability to provide adequate medical care to communities. Over half of California hospitals have requested waivers for conventional staffing ratios per patient, and more anticipate hospital shortages of staffing personnel, especially nurses and doctors. There is a shortage of ICU bed availability, and many hospitals have added surge ICU beds, but they still need additional staffing to meet the ongoing demand. The distribution of COVID-19 hospitalizations is focused in some areas and hospitals, and the burden of care needs to be shared across our statewide healthcare resources. If this increase of COVID-19 patients continues, hospitals may be unable to provide necessary emergency and critical care to Californians. It's noted in Los Angeles that if there's emergency calls to the hospital, if it doesn't look like the patient can survive, they're not even going to respond to those calls right now. Immediate action is necessary to preserve resources, to help prevent the need to adopt crisis standards of care, and to ensure that hospitals can continue to care for critically ill Californians suffering from COVID-19, as well as other life-threatening conditions. Crisis care occurs when the resources are scarce and the focus changes from delivering individual patient care to delivering the best care for the patient population. When intensive care unit capacity is limited by staffing, supplies, or space due to the surge of COVID-19 hospitalization and ICU admissions, immediate measures must be taken to ensure that there is a system-wide capacity to provide safe and appropriate medical care. When hospitals are overwhelmed, they are unable to provide care meeting appropriate medical standards or to implement appropriate infection control measures needed to prevent further spread of COVID-19 in the healthcare setting. If the hospitals lose the capacity to care for seriously ill COVID-19 cases, those highly infectious COVID-19 patients will be pushed into the general community, which can further increase the community transmission. Now, therefore, he, as State Public Health Officer of the State of California, issues this order. In order to prioritize services to those who are sickest and prioritize resources for providers directly caring for them when a county is in a region under the regional stay-at-home order that has 0% ICU capacity, and the CDPH calculation of ICU availability is 10% or less, all hospitals and ambulatory surgery centers shall categorize all elective procedures by tier using the elective surgery acuity scale from St. Louis University and suggested by the American College of Surgeons. Excuse me. All hospitals and ambulatory surgery centers operating under the hospital license or hospital-based clinic in the county shall delay ESA's Tier 1 and Tier 2 surgical procedures for at least as long as this order remains effective in the county. All ambulatory surgery centers still performing surgical procedures shall coordinate with local hospitals to ensure the hospitals, where post-surgery admissions are usually referred to, have capacity to accept any possible post-surgery admission prior to performing any surgery or other invasive procedure. A hospital in the county that has reached crisis care and does not have the ability to examine and treat patients shall notify their medical and health operational area coordinator, local health officer, and CDPH licensing and certification district that the hospital has reached crisis care. When capable, a hospital in the county that has reached crisis care shall, when clinically appropriate, transfer patients as directed by the Medical Health and Operational Coordinator, the MHOAC, when transfers are coordinated within the affected patient's operational area or county. 2. Regional disaster medical health specialists, when transfers require coordination out of the affected patient's local operational area, but within the same Office of Emergency Services region. 3. EMSA director or designee when transfers require coordination outside of the affected patient's OES region. 2. Utilize the California Emergency Command and Transfer Center. Their phone number is 855-301-2337 when the RDMHS or EMSA director levels of transfer above are invoked. Comply with all non-waived and otherwise applicable sections of the Federal Emergency Treatment and Active Labor Act. That's 42 U.S.C. 1395 DD. That's also known as the EMT-ALA, including the requirements to provide stabilizing treatment within the hospital's capabilities and capacity prior to the admission of the individual to the facility or the initiation of a transfer to another hospital, and to provide a medical screening examination to any individual who comes to the emergency department and requests examination or treatment. Not consider a patient's insurance status or ability to pay when making transfer decisions pursuant to this public health order. 2. When they are capable and when such transfers are clinically appropriate, all hospitals in the state of California must accept patients from hospitals in crisis care transferred pursuant paragraph 1EI as directed by the A. Medical and Operational Area Coordinator when transfers are coordinated within the affected patient's operational area or county. B. Regional Disaster Medical Health Specialists when transfers require coordination out of the affected patient's local operational area but within the same OES region. C. EMSA Director or Designate when transfers require coordination outside of this affected patient's OES region. 3. When transferring patients pursuant to this order, the MHOAC, RDMHS, and EMSA Director or Designee should take all measures to ensure balanced distribution of patients across the hospital system and shall immediately notify the MHOAC and RDMHS in the receiving county if it is different than the sending county or OES region. Hospitals directed to and capable of accepting patients under this order must acknowledge their acceptance of the patients within 60 minutes of the request. This order is to take effect immediately. The provisions in Section 1 of this order shall remain in effect for at least 3 weeks until the order is rescinded. All other provisions of this order shall remain in effect as long as the county is subject to Section 1. The state public health officer will continue to monitor the epidemiological data and modify these terms as required by evolving public health concerns. This order is issued pursuant to Health and Safety Code Sections 120125, 120140, 120175, 120195, and 131080, EO N-6020, N2520, N2720, N3920, and other authority provided for under the Emergency Services Act and other applicable law. And this is from the Director of the State Public Health Officer, California Department of Public Health. We previously had talked about the regional stay-at-home orders, and we now also have the supplemental orders as well. So we're going to go over that as well, and then we're going to get into vaccines and what vaccines are being given. I've been giving out vaccines as a clinical pharmacist at nursing homes, and we've had quite an interesting evolution of the process, and we've had 80% of the people in the nursing homes that are taking the vaccine, as well as 80% of the patients in the nursing homes. And so far that we've been doing it, knock on wood, but we have had no adverse reactions to any of these. And even some of the people that had prior problems have not had any issues with it at all. And so when they take the vaccine, they'll take the first dose, and then in 21 days, they'll be taking the next dose of it. And then there's a priority, and we'll be going over all the priorities of the vaccine as well. This regional stay-at-home order has an accompanying supplemental order. Upon assessment of the recent unprecedented rise in the rate of increase in COVID-19 cases, hospitalizations, and test positivity rates across California, the California Department of Public Health is taking immediate actions to prevent the spread of the virus. The state, like the nation, continues to record an unprecedented surge in the level of community spread of COVID-19. California implemented an accelerated application of the Blueprint Framework metrics on November 16th and a limited stay-at-home order on November 19th. However, in the interim, the number of new cases per day has increased by over 112%. And the rate rise of new cases per day continues to increase dramatically. The number of new hospital admissions has increased from 777 on November 15th to 1,651 on December 2nd. And because there's also a lag between case identification and hospitalizations, they're only expecting the numbers to increase. Current projections show that without additional intervention to slow the spread of COVID-19, the number of available adult ICU beds in the state of California is going to be at capacity, as we have seen. This is a sign that the rate of rise in cases, if it continues, is at risk of overwhelming the ability of California hospitals to deliver health care to its residents and from other illnesses. I also worked at the Sleep Train Arena, and we had a supplemental facility of 450 beds. This was in Sacramento, California. At the time, that was in April, May, and June, we weren't using any of these beds. We ended up using about 6 beds at the facility total, and these were nursing home patients that had come from another location. And then that was the only patients that we treated there, because at the time we did not have the surge, but now we could use that facility. Because the rate of increases in new cases continues to escalate and threatens to overwhelm the state's hospital system, further aggressive action is necessary to respond to the quickly evolving situation. While vaccines are promising future interventions, they are not available to address the immediate risk to healthcare delivery in the current surge. The immediate aggressive institution of additional non-pharmaceutical public health intervention is critical to further overwhelming hospitals and to prevent the need to ration care. And so this is the order of the public health officer of the state of California. And there's also a supplemental order as well. Let's see. The California Department of Public Health, responsive to hospital capacity for persons and resident in those regions, the CDPH will evaluate the adult ICU capacity for each region and identify any regions for which that capacity is less than 15%. As we've seen in the state of California, we've had the ICU capacity go down to 0% in the central California region, and also down to 0% down in Los Angeles. All gatherings with members of other households are prohibited in the region except as expressly permitted herein. All individuals living in the region shall stay home or at their place of residence except as necessary to conduct activities associated with the operation, maintenance, or usage of critical infrastructure, as required by law or specifically permitted in this order. Worship and political expression are permitted outdoors, consistent with existing guidance for those activities. And of course, we also have other case law as well that has come out in California and federally as well, that worship could still continue, and there are many worship houses in the state of California and nationwide that are continuing to worship, which is also in direct opposition to the order. D. Critical infrastructure sectors may operate and must continue to modify operations pursuant to applicable sector guidelines. Guidance related to schools remain in effect and unchanged, although they're now having a new order coming out about schools that they're going to reopen, and they have a plan to reopen in California. Accordingly, when this order takes effect in a region, schools that have previously reopened for in-person instruction may remain open, and schools may continue to bring students back for in-person instruction. In order to reduce congestion and the resulting increase in the risk of transmission of COVID-19, all retailers may operate indoors at no less than 20% capacity and must follow the guidance of retailers. If you're living in the state of California, you've probably noticed the long lines getting into retailers or even into grocery stores in some cases. And the reason for this is they have to limit the capacity inside to 20%. All access to retail must be strictly metered to ensure compliance with the limit on capacity. So you'll notice in the front of the stores, they have meters and they're counting how many people are in the store at one time. They have to wait for people to leave and come back out so that they can keep that quota at 20%. The sale of food, beverages, and alcohol for in-store consumption is prohibited. As you'll see, most of the bars in the state of California under ABC, which is regulated by the state, have been closed. Now there are still a few that are still operating in violation of those. To promote and protect the physical and mental well-being, outdoor recreation facilities may continue to operate. Those facilities may not sell food or drink for on-site consumption. Overnight stays at campgrounds are not permitted. Nothing in this order prevents any number of persons from the same household from leaving their residence, lodging, or temporary accommodation, as long as they do not engage in any interaction with any number of persons from any other household, except as specifically permitted herein. Terms in A and B do not apply to persons experiencing homelessness. Now you'll note that over the holidays, Lake Tahoe had so many people going up to Lake Tahoe that they finally had to issue a regional order up there, and the people in Tahoe and the Placer County supervisors on the Placer County side of the lake stopped everybody from going up there. They shut down all the Airbnbs. They wouldn't allow any reservations on them, and they also shut down a lot of the VRBOs. However, the problem with that is that the Nevada side was open, completely wide open, and then the El Dorado County side was open. So you have different sides of the lake, different rules and different regulations, and it can get very confusing as to what laws and regulations you need to abide by. Except as otherwise required by law, no hotel or lodging entity shall accept or honor out-of-state reservations for non-essential travel, unless the reservation is at least for the minimum time required for quarantine, and the persons identified in the reservation will quarantine in the hotel or lodging until after that time period has expired. Down in Los Angeles, they now have a statement saying that anybody coming into the region or going out of the region must quarantine for 10 days. And that's because the ICU capacity is down at 0%. This order originally took effect on December 5th and then was continued on January 4th. For regions where the adult ICU capacity falls below 15% after the date of this order, the terms of this order shall take effect 24 hours after that assessment. The terms of this order shall remain in place for at least 3 weeks from the date the order takes effect in a region, and shall continue until the 4-week projections of the ICU capacity is greater than or equal to 15%. 4-week adult ICU bed capacity shall be approximately twice a week. If after 3 weeks from the effective date of the terms of the order, CDPH's 4-week projections of the region's total available adult ICU bed capacity is greater than or equal to 15%, the terms of this order shall no longer apply to that region. After the termination of the terms of this order, each county within the region will be assigned to a tier based on a blueprint for a safer economy, as set out in the August 28, 2020 order, and the county is subject to the restrictions of the blueprint. They will continue to monitor epidemiological data and will modify the regional stay-at-home order as required by evolving public health conditions. If it is determined necessary to change the terms, these modifications will be posted as well. When operative in a region, the terms of the order supersede any conflicting terms and other orders, directives, or guidance. Specifically, for those regions with ICU bed capacity triggering this order, the terms of this order shall supersede the state's blueprint for a safer economy and all guidance during this operative period. In all regions that are not subject to the restrictions, the blueprint for a safer economy shall remain in effect. This order is issued pursuant to Health and Safety Code sections 120125, 120130C, 120135, 120140, 120145, 120175, 120195, and 131080. EON 6020, N2520, and other authority provided for under Emergency Services Act and other applicable laws. This was also issued by the Acting State Public Health Officer for the California Department of Public Health. Now we get into some of the supplemental orders as well. The supplemental order accompanies the regional stay-at-home order, acting as the public health officer for the state of California. In order to ensure that California's grocery stores are able to effectively deliver sufficient quantities of food, it is necessary to ensure capacity for stores. Therefore, in regions that are subject to the regional stay-at-home order, standalone grocery stores where the principal activity is the sale of food may operate at 35% of capacity as opposed to 20%, based on the fire department occupancy limits. All access to grocery stores must be strictly metered to ensure compliance with the limit on capacity. The sale of food, beverages, and alcohol for in-store consumption is prohibited. The travel restriction in paragraph 3 of the regional stay-at-home is applicable only when at least one region has an adult bed capacity of less than 15%. Paragraph 5 of the regional stay-at-home order is modified as follows. For regions where the adult ICU bed capacity falls below 15% after the effective date, the terms of the order shall take effect the next day after the assessment is made. All other terms remain in effect. The order is effective immediately and shall remain in effect as long as the regional stay-at-home order. This order is issued pursuant to Health and Safety Code sections 120125, 120130C, 120135, 120140, 120145, 120175, 120195, and 131080, and other authority provided for under the Emergency Services Act and applicable law. Now we're going to be tracking COVID-19, and we're going to get into the use of vaccines and questions about the vaccines. Tracking COVID-19 in California. As of yesterday, January 7th at 11 a.m., we had 2,518,611 cases total. Today, we had 36,385 cases. The deaths are 28,000 total, 583 today. So a lot of the deaths, although they have comorbidities, if they also have COVID-19, then they classify them as COVID-19 deaths. Okay, so I've been giving the COVID-19 vaccine. We gave out our first doses of it, and it went very well, and it was very easy to administer, and we have had no issues with it. COVID-19 vaccination is one of the most important tools to end the COVID-19 pandemic. The state is prioritizing vaccines, and that's important to understand. I've had people offer me money. We have had everybody that I've worked with been offered all kinds of things to give people the vaccines, but there's a priority that they've set out, and we're going to go over that as well. The state is going to prioritize all the vaccines so that there's equitable distribution to everyone in California who wants it. We expect to have enough supplies to vaccinate Californians in all 58 counties by summer 2021. They also estimate that by the end of the month that most of the nursing homes and the healthcare workers will have already been vaccinated as well. The U.S. Food and Drug Administration issued an emergency use authorization for 2 COVID-19 vaccines. And more vaccines will actually be authorized early this year. The COVID-19 vaccines authorized by the FDA so far have been shown to be safe and effective in clinical trials. The U.S. vaccine safety system ensures that all vaccines are as safe as possible. To ensure the COVID-19 meets safety requirements, California performed its own scientific safety review work group of experts. They also confirmed the COVID-19 vaccines authorized by the FDA are safe and effective. Now we get down to the big question, when can I get vaccinated? California is allocating, and vaccination providers are administering this vaccine as they become available. California is trying to be very transparent and careful to ensure vaccine distribution. And actually, a lot of the healthcare workers were not using the vaccine, and then there was an excess of these vaccines, and then they tried to figure out who to give those to. Initially, the vaccine supply will be very limited. At first, vaccines will be provided to healthcare workers and long-term residents in a coordination with the California Department of Public Health guidelines. After healthcare workers and long-term care residents, the next to be vaccinated will be individuals who have a higher risk for severe disease or death due to age or other factors, are unable to work at home, live or work in geographic areas that have been highly impacted by COVID-19, such as we've seen down in Los Angeles and in the Central Valley. They are most likely to spread disease to other workers or to the public. So we're currently now in phase 1A. That's where I've been going out, and other providers have been going out to the nursing homes, and also all the healthcare workers have been getting vaccinated. And that's phase 1. And this is about 3 million people. And they estimate that by January 25th or somewhere around the end of this month that phase will have been completed. And then we're going to move on to phase 1B. And then we have under 1B Tier 1, we have individuals that are 75 and older, and those at risk of exposure at work in the following sectors: education, childcare, emergency services, and food and agriculture. Then we'll be moving on to 1B Tier 2. That will be individuals 65 to 74 years of age, and those at risk of exposure at work in the following sectors: transportation and logistics, industrial, commercial, residential, and sheltering facilities and services, critical manufacturing. Then the next one will be congregate settings with outbreak risks. That includes incarcerated and the homeless. A lot of the, some of the facilities, such as Department of Corrections in many areas, have already been given the vaccine. And a lot of people were upset with that because they said, well, why is it that they get the vaccine? But one of the problems you have when you have incarcerated is that these diseases are very prolific and they transfer to other people quite readily because they have a lack of really adequate facilities and a lack of current ventilation, a lack of current heating and air conditioning systems, and all of this together creates a serious problem, and it can be easily transmitted in the correctional facilities. I worked in a lot of the correctional facilities. I've been in San Quentin. That's probably one of our oldest facilities. I've been at Folsom Prison. I've been at Mule Creek and Ione. Mule Creek is a newer one, but San Quentin, for instance, is extremely cold. It's extremely old. And many of the facilities in there don't quite work adequately, and even the ventilation is a serious problem as well. And so in the places like these, where there is lack of ventilation and there is improper procedures being done, this can be a real problem for the spread of COVID. Now we're moving on to Phase 1C. Phase 1C will be individuals 50 to 64 years of age, people 16 to 49 years of age, and have an underlying health condition or a disability which increases their risk of severe COVID-19. Those at risk of exposure at work in the following sectors: water and wastewater, defense, energy, chemical and hazardous materials, communications and IT, financial services, government operations, and community-based essential functions. Vaccination plans for each county are also available, and you can review those for your particular county. Moving through vaccine phases. After focused and appropriate efforts to reach all of these prioritized groups, vaccine providers may offer doses to people in lower priority groups when demand subsides in the current groups. Doses are about to expire according to labeling instructions. And as we talked about, so many of the healthcare workers, I think there was less than 50% in many areas that were getting the vaccine. So when they had these extra doses, then they had to try to figure out who to distribute them to. And then you can ask yourself, of course, is how are these vaccine decisions being made? They're made by a group of experts and community representatives who work together to make sure vaccines are prioritized effectively. A drafting guidelines work group is developing California-specific guidance for the prioritization and allocation of vaccine when supplies are limited. Community Vaccine Advisory Committee. The Community Vaccine Advisory Committee is providing input and feedback to the planning efforts and resolving barriers to equitable vaccine implementation and decision making. Vaccine allocation and administration. Once a week, the federal government announces anticipated allocation figures for each state. The number of allocated doses provided by the federal government is a projection and subject to change. Local California providers are required to place their orders, which are reviewed by the state and submitted to the federal government. The federal government will then authorize the order and submit the request to the manufacturer. The manufacturer or central distributor ships the vaccine directly to the local California provider. And there's very serious requirements for the refrigeration of these materials. Now, there was an incident of a pharmacist who decided that he was part of a conspiracy group, and he decided that he didn't want anybody to get the vaccine. So he left some of them out overnight for 2 nights. And as a result, he was arrested and he's now facing serious charges for the destruction of the vaccines. And so even though he didn't agree with that, he was worried about people changing their DNA, but it doesn't change their DNA, it changes the RNA, and it changes the RNA of the virus. The manufacturer or central distributor will ship the vaccine directly to the local California provider. It can take a week or longer between when doses are allocated to when they arrive, or providers, and are ready for administration. To track vaccine allocation and administration, vaccine doses are allocated weekly by local health jurisdictions, multi-county entities, and CDC long-term care facilities. Vaccine doses are administered or vaccine doses given are tracked by the California Office of Emergency Services daily. Now we're going to get into a little bit about how do these vaccines work. Vaccines work by helping our immune systems and fighting infections in the future. The COVID-19 vaccine will help to protect us from the virus that causes COVID-19 without having to actually get the illness. It will take a few weeks after the last dose to become fully protected. On the days after taking the vaccine, some of the most common complaints are sore arm. Just about everybody I've talked to, they do complain about a sore arm. Some people will have aches, fatigue, or fever, but these are not harmful. Then some people can have allergic reactions to it as well. These symptoms signal that your immune system is developing a protection against the virus. What are some of the benefits of getting vaccinated? COVID-19 vaccines are meant to prevent you from getting COVID-19 and spreading it to others. The ability of the COVID-19 vaccines to protect us from spreading the virus to others is not yet known, but is being studied carefully. So there's a lot of research that still hasn't been done. Typically when they develop vaccines, they do a lot more research. Unfortunately for this vaccine, there's a lot of research on that has not been done. Vaccination planning. Who's getting the vaccine now? Who is next to get the vaccine, and when? COVID-19, as we talked about, vaccines are currently available right now only for healthcare workers and residents in long-term care settings due to limited supplies. Both CVS and Walgreens are currently administering the free COVID-19 vaccine to residents and staff in long-term care settings. So what is done is they check to see if your insurance, they will bill your insurance company, and if you don't have any insurance at all, you still can get it paid for by the government. So there isn't really any reason for you not to be getting the vaccine for cost issues. Next on the priority list for vaccination later this winter, as we discussed previously, are individuals 75 and older. Those at risk of exposure at work in the following sectors: education, childcare, emergency services, food and agriculture. How do I go about getting the COVID-19 vaccine? If you're a healthcare worker, you can contact your employer. If you're a long-term care facility resident, contact your caretaker. In many parts of the state, CVS and Walgreens pharmacies will administer the vaccine to residents in long-term care and staff. Everyone else should coordinate with their healthcare providers. When can the general public who are not otherwise in phase 1 start getting vaccinated? Spring 2021 is the best estimate, but that may change. Because right now, they've estimated that the vaccines at the nursing homes and for healthcare workers should be completed by the end of January. How could I sign up to be a COVID-19 vaccine provider? CDPH is in the process of developing enrollment resources. Initial enrollment in the California COVID-19 vaccine program is limited to sites selected by local health departments. All other interested providers, including clinics and pharmacies, will be welcome to enroll early this year. Getting vaccinated. How many COVID-19 vaccine doses are needed? Okay, so we have already administered the first phase of the vaccine. So every person who's vaccinated will have the vaccine, and then 21 days later they will get a supplemental boost as well. In the case of the Pfizer vaccine, they give it 21 days apart. In the case of Moderna vaccine, that's 28 days apart, so it's 4 weeks instead of 3 weeks. But both doses have to be given in order to have the immunity and the vaccine work. How much is the vaccine going to cost? Well, as we talked about, it's not going to cost anything because they'll either bill your insurance or they have a separate fund set up through the federal and state governments to provide that for you. Can I register somewhere to get the COVID-19 vaccine? How will I be notified when it's my turn? There is not currently a statewide registry. To get notification for the COVID-19 vaccine, if you're a healthcare worker, you'll contact your employer. Long-term care residents will contact their caretaker or the facility where they're located in, as the providers are actually going to the nursing homes to give the vaccines. I've already had COVID-19. Should I still get a COVID-19 vaccine? Yes. At this time, we don't really know if someone is protected who has already had COVID-19 before from getting it again. And in addition, there's a lot more variants of COVID-19 as we've seen coming out of the UK and from Europe. And so it's modifying as all vaccines do. And so if you get the vaccine, you have a better chance of protecting yourself, and they do believe that it will protect you from these variants as well. And then after you're vaccinated, what can you expect? Well, I still need to wear a mask after getting a vaccine. Yes, you should still wear a vaccine. How much protection the vaccines provide is still unknown. As we talked about, there hasn't been a lot of long-term studies done on the vaccines to know some of the answers to these questions. It is important for everyone to continue using all the tools available to help us stop the pandemic, like staying home and isolating from others when they are sick, wearing masks, washing hands often, social distancing. Together, COVID-19 vaccine and recommendations how to protect yourself and others. Does being vaccinated mean I can visit with loved ones without risking our health? Even with a vaccine, you can still spread COVID-19. Even after vaccination, you should stay home as much as possible. Isolate if you're sick, wear a mask, wash your hands, and keep your distance from people not in your household. Will the COVID-19 vaccine give me COVID-19? How many people have I had ask me this question? No, it doesn't mean that you're going to get the vaccine. They don't contain any active coronavirus at all, and they cannot give you COVID-19. So there is no active coronavirus in the vaccine. So don't worry about getting COVID-19 if you're going to take it. Will the COVID-19 vaccine make me test positive for COVID-19? That was the next question. No, a vaccine will not cause you to test positive on viral tests. If your body develops an immune response, there is a possibility you may test positive. Antibody test indicates you may have protection against the virus. And then some of the people are concerned also, how is their privacy protected if I take the COVID-19 vaccine? California law strictly limits how personal information about those who are vaccinated can be shared. California negotiated with the federal government to limit the required data sharing to only information that will not allow an individual to be identified. I have allergies. Should I get the COVID-19? Well, that depends upon what kind of allergies you have and what kind of reactions you've had to other vaccines. If you have ever had a severe allergic reaction to any ingredient that is in the COVID-19 vaccine, you should not get that specific vaccine, especially people that are allergic to polyethylene glycol. If you have had a severe allergic reaction to other vaccines or injections, you should ask your doctor if you should get the COVID-19 vaccine. Any person with a history of severe allergic reactions not related to vaccines or injections may still get vaccinated. People may even get vaccinated with a history of allergies to oral medications, family history of severe allergic reactions, milder allergy to vaccines. If you have had a severe allergic reaction after getting the first shot, you should not get the second shot. So if you do have problems and you start breaking out, have breathing problems, have rashes, you should definitely not get the second shot of the vaccine. One of the other questions that comes up very frequently is, can pregnant or breastfeeding women be vaccinated against COVID-19? Yes, pregnant women have a higher risk of complications from COVID-19 disease. There are no study results yet on the safety. And one of the other issues, as we talked about, is all of the vaccine manufacturers, because of the way that they rolled this out, are exempt from any lawsuits relating to any of the reactions or problems with this drug. Experts believe the vaccines are unlikely to pose a risk to the woman or the fetus. Pregnant women can talk to their doctor about making this decision. The next question is the COVID-19 vaccine safe for children? It's currently not recommended or given to children. It's recommended the Pfizer vaccine is for patients only that are 16 years of age or above. The Moderna vaccine is only available to ages 18 and above. They haven't done enough clinical trials in children yet. They're still doing them to determine whether they're safe for children or not. Also, the chances of children getting COVID-19 is much less than it is for people over the age of 18. So they may not necessarily need a vaccine. But once the trials are done, and if it does determine to be safe and effective, then we can revisit that issue as well. How effective are the COVID-19 vaccines? Based on the large clinical trials, the first two COVID-19s available have shown 94 to 95% efficacy against a person becoming infected with COVID-19. So that's a very high efficacy rate for a vaccine. And since, even though we do have changes or alterations in the virus and in the type of COVID over in the UK and in Europe, it's still been shown to be effective against preventing those as well. And then also, is the one dose of COVID-19 vaccine effective? As we talked about with all these vaccines, you have to get one with the Pfizer, and then 21 days later you got to get a second boost. And then with the Moderna, you have to get the first one, and then 28 days later you have to get the boost. Getting the second dose of a vaccine will make it much more effective. When the COVID-19 vaccine becomes available, and after you receive your first dose, you should schedule your dose appointment before leaving the doctor's office. And in the case of the nursing homes, what we do is we give the vaccine and then we arrange to come back again in 21 or 28 days, as the case may be, to give them, all the residents and all the healthcare workers at that facility, their vaccines to make sure that they're in compliance. Will I have a choice between various COVID-19 vaccines? Well, that depends upon which vaccines are available. Right now, most of the vaccines that we've been using are the Pfizer vaccines. I haven't dealt with any of the Modernas yet. Will you make the COVID-19 vaccine mandatory? Well, there's a debate about this, but currently there is no mandatory vaccine requirement from either the state or federal government. They hope that by educating people about the safety and efficacy of the vaccines that people will voluntarily opt to receive them. But as we've seen with some healthcare workers, we've had a non-compliance of at least 50% in many cases. And in some of the nursing homes I've been in, there was actually 80% compliance, which was much higher than other facilities. And so the COVID-19 vaccines that are authorized for emergency use are the Pfizer BioNTech COVID-19 vaccine. That's under the Emergency Preparedness and Response for Coronavirus, as well as the Moderna COVID-19 vaccine as well. The FDA Center for Biologic Evaluation and Research regulates the vaccines and other biological products, and they issued an advisory discussing emergency use authorization for the COVID-19 vaccine. That was on December 17th. And now we're going to talk a little bit more specifically about the Pfizer BioNTech COVID-19 vaccine and its use. On December 11th, the U.S. Food and Drug Administration issued the first emergency use authorization, which is also known as an EUA, for a vaccine for the prevention of coronavirus disease 2019, caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, in individuals 16 years of age and older. The emergency use authorization allows the Pfizer-BioNTech COVID-19 vaccine to be distributed in the U.S. The authorized use is for individuals only 16 years of age and older. As we talked about the Moderna vaccine, it was 18 years of age and older. Some of the side effects we'll get into now. The most commonly reported side effects typically last several days were pain at the injection site. I've heard that from numerous people. Tiredness, headache, muscle pain, chills, joint pain, and fever. Of note, more people experience these side effects after the second dose than after the first dose. So it is important for vaccine providers and recipients to expect that there may be some side effects after either dose, but more so after the second dose. So that's something else to keep in mind. The FDA noted the process for the COVID-19 related guidances, and they provided recommendations, regulatory information, guidance, and technical assistance necessary to support rapid coronavirus disease response efforts. As a result of the consequences of the COVID-19 pandemic, a public health emergency declaration was issued, as we talked about, by Alex M. Azar, Health and Human Services Secretary, on January 31st, 2021, has been subsequently renewed. So anyway, getting back to the question of the vaccine. Should you get the vaccine or should you not get the vaccine? Well, that's an individual decision that each of us is going to have to make in the upcoming months. A lot of people are afraid because it's new and it hasn't been widely tested. So you have to decide what the upside is or the downside is of you getting this vaccine. Some people are waiting to see how other people respond, but part of the problem with waiting is that you could be actually causing more problems for yourself and others by waiting to take the vaccine. So anyway, in conclusion, what I'd like to say is that make sure to follow all the regional stay-at-home orders and also all the orders from the Department of Public Health. And if you have any questions about vaccines, you can contact either your local pharmacy or your local physician for any further questions relating to that. And thank you and have a nice day.